here. So she is a valedictorian of a class of one. So
Oh, well,
she's
I'm
kind of
glad
fun to have
she's here
around.
too, hearing my story. But basically, it's not a rare story. I'm very sure that too many people are going through the same thing, and it's basically me finding myself having to fight with my insurance company to get coverage for a medication that my own doctor has deemed it as medically necessary. So at the beginning of maybe last year, I realized that there was something going on with me, with my body. I started experiencing different symptoms related to um, blood pressure, cholesterol, things related to my hormones, getting to the point where now I'm not feeling like the way I used to, having trouble with finding energy, always feeling fatigued. And then finally, nothing worked what I was doing in my personal life. Nothing worked with, the supplements that I was taking, trying to continue being an active person. I always have been the type of person that also, like yourself, very close to my dog. I like taking my dog for walks morning and evening, finding time to work out and then doing all the other stuff. And then it got to a point where I just felt like I didn't have any energy to do any of those things. And so I was struggling, as well as like experiencing weight gain, going to the gym, doing all the right things, working with a dietitian, and still seeing my weight going up and up and up. And then, like I said, it got to a point where I wasn't feeling healthy and I wasn't looking healthy. And then to the point where I went to my doctor. And then that's when I got told, you're having certain symptoms, let's do some blood work, let's do some tests, and finding out that I have PCOS with insulin resistance. And it was a journey for me to find information on what that actually is, because I soon found out that different doctors have different views of what actual PCOS is. And so navigating through that, figuring out what that actually means for me, why my body is going through what it's going through, I soon found an endocrinologist that prescribed me Ozempic at the very beginning of my journey. And although Ozempic has helped a lot of people with their, blood sugar, diabetes, pre-diabetes, etc., I didn't find that to be helpful for me. I had severe side effects from it, so I had to discontinue it. And from there on, going back to my PCP, telling them this is what I was treated with, it wasn't successful for me, what are other options? I was told, another medication that's very similar that sometimes is even more effective is Manjaro. And at that time, Manjaro was only indicated for type 2 diabetes. Although I was diagnosed with PCOS, insulin resistance, I'm not there yet, right? And I'm trying not to get there. I'm trying not to be a statistic where, down the line, I'm starting to have more side effects, more health complications, and then being diagnosed with type 2 diabetes. I'm trying not to get there. I'm 38 years old. I don't feel like the way I used to. And it has a lot to do with all the symptoms that I'm having from, my conditions. And so what I've been trying to do is get another medication that has the same ingredient, which is called Zepbound. That's more for obesity and weight management. And that's where I'm having trouble with my insurance company getting it approved. I've done everything possible in my power to be able to manage all the symptoms, including weight gain, which is something that is very much related to PCOS and insulin resistance. And it hasn't been successful at all. There was a time where I was active. I felt great. I was able to run 2 miles in 10 minutes at some point and do heavy lifting because I enjoy, doing a lot of weight management, a lot of weight bearing exercises. All of that, I was able to do it at my heaviest weight, but I wasn't losing the weight. And so with that came other weight related comorbidities, like I mentioned earlier, high blood pressure, high cholesterol, was also diagnosed with sleep apnea and all these other indications that Zepbound medication has to cover. It was indicated FDA approved for obesity and other weight-related comorbidities. And so going through the process of trying one medication and it failing, seeing a dietitian for such a long time, doing my part and continuing with my lifestyle modifications and exercise and moving, none of that worked for me. So my doctor deemed that medication specifically necessary for me, and my health insurance is not approving it. And so I know I'm not the only person that is going through this, that is being told, do step therapy, right? I even had something similar happen to me with medication related to my migraines. I had to go through step therapy, and it was horrible because a lot of the medications I had to try before the one that I'm being prescribed now were medications that caused severe side effects to the point where I had to go to the emergency room on Christmas because I'm being prescribed gabapentin, because I'm being prescribed other medications that are topiramate, I think it was, that caused me also so many side effects. And so I know getting medication like a GLP-1, like Zepbound, get denied is very common, but it's not the only medication that is being denied to other patients. Like I said, migraine medication was being denied to me until I tried all these other things. And it's hard to go through that as a patient. It's hard to go through something when you don't really understand how it works. And I've taken the time to really figure out how the healthcare system works, how insurance companies work. And it's very, very daunting information. It's a lot to take in, and learning about it and then going through it firsthand is overwhelming. And so I've been dealing with this for a whole year. And because I'm the type of person that I am, that I like learning and I like wanting to know more, okay, I'm not going to take no for an answer, but what can I do to educate myself so I could be a better advocate? I think that's where I came across your information, and whoever you were talking about in your life sounded very much like me, someone that has gone through all the steps possible in their power to comply with what their insurance company is advising them about, right? Because they are not, they don't have a medical license to be telling any patient what they should or should not take. However, we're being put in a situation where we're having to listen to the insurance companies tell us, you could take this or you could take that, or no, you can't take this, but you could take this other thing, even though your own doctor is telling you, this is what I'm deeming it necessary for you to take for your symptoms, for your conditions, for your diagnosis. And so that's where I'm at this point in time, fighting with my insurance company.
So I love your can-do spirit and your ability to pivot. And so I connected you with a good friend of mine. So let's name some names here, okay? Who's the insurance company we're ragging on right now?
My insurance company is Ambetter. I live in Texas, so I have a policy through Texas, through actually Affordable Care Act with Ambetter. The reason why I went that route and not with my insurance company is because my insurance company, my work, my job, my employer, is because the insurance that they were providing through my work wasn't something that I could benefit from. I work remotely, so the company that I work for is in another state, and what they were trying to provide me was a network that doesn't even exist where I live. I live in South Texas, so I wouldn't be able to get a provider within that network. And a lot of the medications I was already on were not going to be approved through their formulary. So my only option has been Ambetter through the Affordable Care Act. And yeah, that's where I'm at right now. That is
okay.
The insurance company.
So I like to identify the players. We're dealing with Ambetter on the market exchange, so an Obamacare plan, Ambetter of Texas. Now I can tell you from my own experience with Ambetter in Missouri, Ambetter in Missouri is something we can kind of work with, but I'm right on the Missouri-Illinois border, and Ambetter of Illinois is the worst. So all Ambetters are not created equal, but
yeah.
Ambetter is nothing more than a middleman doing none of the actual healthcare, none of the actual work, making and overriding clinical decisions of your physicians and of my physicians. And they literally don't really give a rat's behind about individual care. They want everyone into the one size fits all, which is Ambetter's profitability plan. So you connected with my colleague, Dr. Warris, who's amazing, and he helped you do a patient appeal. You now have the top people at Ambetter of Texas calling you, right? And
Yeah,
saying, what?
not a lot, to be honest, not a lot, unfortunately. So getting to the point where we have someone in contact with me that is at the top, which is the CEO of Ambetter. The results have not been great for me. I am not happy with the way things are going. When I first spoke to Mr. Cunahan, that's his name, Kevin Cunahan, he promised me that he was going to get to the bottom of it. He wanted to talk to more people within the company to get more clarification. Even though I sent him a letter that explained in detail what I've been going through. Anything that he needed to know, and anyone else that needed to know about me, what I've been going through, what has been my diagnosis, what has been my treatment, what has failed for me, and what my doctor is now trying to get a prescription for me or coverage for me, has all been laid out there in that letter. It was very extensive. It had all the information that they would need in detail, and yet he still needed to speak with people. And that went on for quite a few weeks. A lot of phone tagging, I would say, describe it. Calling him, missing him calling me back, telling me, give me some more time. I'm, trying to figure things out. I'm trying to talk to some medical people from the pharmacy department. And I told him, I hope you're talking to these people and, and the results in the hopes that you are going to help me, get what I need to treat,
Successful, right?
Yeah. And he said, of course, I want to be able to help you. I want to do the right thing. That was what he said. I want to do the right thing. And so in good faith, I gave him all the time that he asked for. I've been patient. I've been available. Unfortunately, because of all my symptoms and my diagnosis, I had to get FMLA at some point so I could be able to miss work, go to all my doctor's appointments, because at this point I'm seeing so many specialists to deal with so many of the symptoms that I'm dealing with, that it feels like for one of my, side effects or one of my, symptoms, I'm seeing a specialist for each and every one of them. So even making time throughout my day to be able to be available for Mr. Cunahan has been very, very hard for me. And even with all of that, the last phone call that I had from him was that he's not going to approve it. They're not going to approve the medication Zepbound, and that they're so sorry, but they are not going to do that. And so with that being said, I haven't given up. I'm not taking no for an answer because I know that it's within my rights. I've done everything possible, everything in my power to be able to say that I've gone through all their, levels of care that they want to see. And yet I'm not being treated for what I need to be treated for. So that is the results, being told no, flat out no, and with very, very little explanation. And so being a patient or a payee, as they like to indicate or
Right.
say we are, I didn't get, the answers that I was hoping for. I don't feel like I don't think they see this as important, because I think he would have taken more time to talk to me and explain to me. And he did the complete opposite. He just said no and didn't give me an explanation. And it's been after that last phone call, it's been a lot of me reaching out to them via email, again, reiterating what my situation is, what I'm asking for, which is a formulary exception. And
Sure.
reminding them that I've tried everything that I could, and one of their arguments is that I'm wanting medication for weight loss, but not for obesity, and not for obesity related comorbidities. And so they're trying to make this, hairline of distinction, in which it is wrong. It's not the correct thing that's going on here. And so they're very much hankering in that and making that as an excuse as to why they don't want to cover that medication. And it's wrong. It's not right. That information is not right, but they're wanting to go that route because it's more convenient to them to say no to me than actually cover my medication.
And do the right thing. Well, I applaud how you have the stick-to-itness, the tenacity to continue to advocate for yourself. And I would love for you to shoot me a text or an email with his email address, because I'd love to send him this little interview and invite him to be on our podcast to explain his side of this, which I'm sure he will decline. But what I'd really like to ask TikTok and podcast viewers and listeners are, if we could find 4 more people in the state of Texas that are covered by Better of Texas, that are dealing with something similar to our friend Felicia, that are dealing with trying to get a formulary exception, we want to hear from you. Because if we can find, which I am assured that this is a pattern and practice of Better of Texas, because this is what they do. They delay and deny, and they try to separate everyone. But if we could find 4 more viewers or listeners on any social media platform that have Better of Texas, that are looking for a formulary exception, that have been denied, please email this one right here. Email Claudia. Do they know your email address?
Yeah, you're getting me a lot of emails.
Yeah, so what? Listen, the best thing we can do
Claudia's popular.
Yes, the best thing we can do is say, hey, every one of us is a patient. Every one of us has been delayed and denied by an insurance company. And he is a fat cat sitting up in some office.
We're not body shaming.
No, well, whatever. This leadership guy, what's his name?
Kevin Cunahan.
Kevin Cunahan. Better, something leadership person in Texas. You need to come on here and make this make sense, because you delay and you deny patients. She's a premium paying citizen of the United States of America that you are preventing from getting access to care. It's not right. We want it changed. So call me, text me, send me a carrier pigeon. We need some help here.
Or call Felicia.
Felicia.
I'm so sorry.
Yeah, you have her number. You've got plenty of nonsense that you're on the phone with her about. Look, if we cannot stand up for one another as patients, what on earth are we going to stand up for? We have to help one another. And where there's 1, there's 5, there's 10, there's 20. So that's really what I wanted to do by having you on the podcast today. Oh, I love the mustache and the hat.
I'm going to clarify it a little bit.
Okay.
So if your insurance company is Better and they're getting in the way of you getting your prescription, send me an email.
Better of Texas.
Oh, Better of Texas. I forgot the state.
Yes.
Almost there.
Those are the people we urgently want to hear from, because what we'd like to do is get arm in arm with you and our friend Felicia here. And let's tell Kevin, we have a few more people.
And we hate you.
Okay. We hate Kevin right now. So Kevin, change our mind. You have on your stupid website, Kevbo, that you're here for the people. I say not so much.
Felicia's the people.
She is the people. She's a premium paying patient, and he is a premium collecting leadership person that's saying, no, 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 no.
And you pay.
That's not okay. We need access to care. You don't have access to care. You need it. We got to just ratchet it up a notch and let's get it.
And hopefully Mark Cuban's Costless Drugs is going to come out with something really similar that'll work just as well soon.
That would be an amazing thing. Are you connected with any other sort of advocacy or media groups that we could reach out to?
Personally, no, I'm not. I would like to be. I definitely am going to take the time to see what other social media or groups that are there to advocate. I came across information from ProPublica, and that was like my little segue in getting connected with you, Claudia, and then with you, Julie, because the person that you were talking about, the patient that you were talking about, used information in ProPublica's website to be able
Yes.
to do a claim. And that's where I was at. I was trying to use the information from ProPublica to make a claim because what I wanted was any correspondence that had to do with that case that was denied. And I wanted to know what is the reason behind it, because the insurance company never was able to give me a straight answer. And whatever information they did give didn't sound right, didn't sound like they were following FDA regulations. And so if that's the case, I want to know what's your reasoning behind it. What's going on that, this is the results that I'm getting. And like you said, I am a payee and it feels like I'm paying to get my medication denied. And that is ridiculous. And I'm not going to stand for it. And I'm not going to stop.
Love it.
You're
Love
not
it.
backing down.
No, you do not back down. Well, I appreciate you taking the time to come on and tell your story. We will continue to push the envelope and push your story, and anybody that we can hear of, any of your friends that have Ambetter of Texas, give them Claudia's name and number. Please text me Kevin's email address, because I would like to send him an email, because there are more of you out there, and he needs to stand up and do the right thing. So thank you for taking the time and sharing with people the journey, because every one of us is a patient, and I appreciate you, and I will speak with
Appreciate
you
you
soon.
guys.
It's
Thank
so
you.
nice to put a face to you also.
Thank you. Likewise. Well, no, I already saw your faces. So it's time to see mine. All right. Well, thank you so much for having me. It was a pleasure.
Absolutely. Have a
Thank
great day,
you.
friend. Bye-bye.
Thank you too. Bye.
I'm really good at ending things.